It's time for New Wellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Welcome, everyone, to another wonderful, beautiful day. Every day is a beautiful day. Every day is a wonderful, blessed day. I am so happy and always thrilled of all the wonderful guests that I have. But today, we're going to be touching on the topic, or not just touching, a little bit more deeper on the topic of things that make men cry. The things that make men cry. And I'm just so happy to have Dr. Gloria Morrow here, who is a clinical psychologist, and her background and her bio is so extensive. So we have emailed them out to a lot of people. So I want to thank you. Thank you so much, Dr. Morrow, for being here today. Thank you very much. Thank you.
Thank you for having me. This is a wonderful opportunity, and I just want to salute you. I'm one of your greatest fans.
Oh, my
because
goodness.
you do so much to help us to be healthy and whole, and so I follow your work, and I consult with you when I need to, and I am thankful that you are doing what you're doing to help the world.
Thank you very much. Thank you very much. And the same with you. I called you about my own patients and family, so you're wonderful. As a clinical nutritionist, clinical psychologist, might as well say nutritionist as well. But you are absolutely wonderful. And so we're going to start off a little bit. For me, I want you to sort of tell people a little bit about yourself, because you know you.
Okay. Yeah, I do know me by
Yes,
now.
you do.
It took me a while, but
Yes.
I think I know me by now.
Most definitely.
Well, I'm again happy to be here. I am a clinical psychologist, and I am the director of behavioral health for Molina Healthcare, which is a fairly new role for me. I get to work with patients in the clinic, and I also get to do administrative work to help direct our behavioral health department.
Wonderful.
And so
it's so needed.
Oh, my gosh.
They need people with a good heart.
Yes.
And you're very spiritual as well. And that's so important in the healthcare industry, for a person to really see a person beyond a number.
Yes.
I want to say number, because that's basically how it's kind of look when you come in, even though you have a name, because I worked hospitals in the past. But you see beyond that. God has given you a wonderful gift.
Thank you.
Beyond being a clinical psychologist. He has given you a wonderful gift. So you see beyond that. This is why people are healed, and they do very well with you. I know that about you. I've been knowing you for years, and I follow you as well.
Yeah, well, one of the things that is important for our healthcare is to understand that integrative care is very important.
Yes.
Because when people are dealing with physical illnesses, they automatically are going to be dealing with mental health and emotional illnesses. So we finally are trying to marry the mind, body, and spirit, as we should, so that we are providing holistic care.
Well, most definitely. Yeah. That is so important. Matter of fact, I had a conversation with my daughter on the way here, Siobhan, and we were talking about just that with someone that she's working with. She's a clinical nutritionist. So she had a patient. She was dealing with that as well, as far as referral. So,
absolutely.
It's really important. So I just want to thank you again for being here. And we're going to kind of jump in. There's so many things, but still, you didn't tell me a little bit more about yourself.
Okay, all right.
A little bit more. Okay.
Well, I'm really excited because in this stage of my life, I get to do some things that I've always wanted to do. So in addition to doing my clinical work and providing opportunities for women to be healed and whole, I do a lot of work with them, and I do a Facebook Live every Monday night trying to empower men and women to become emotionally and mentally healthy by using the Word of God, and also some of our secular strategies. Exactly. But I also write plays. And
I know. That's what we're going to talk about. I was there.
Yeah, thank you so much for supporting me and having me on your show.
Thank you.
But I write plays, and I just finished the first draft of my first screenplay along with another author, and we are just excited about this project and hopeful that God will use it to bless people.
He will, because that's who you are.
Thank you.
And you put God first.
Yes.
In what you do. So it's going to be just as inspiring as the things that make men cry. And so it started out a book and then a play, or how did
Yes.
that? Okay.
I love to tell the story because it's pretty powerful. I had a couple in my office, and the woman, as we can do, we can talk, and she talked, and he sat there very quietly. And so, as is my practice, I kind of separate them for the next session and see either of them individually, so I can give them an opportunity to share from their own perspective without interruptions.
Yes.
And so I chose him first, and when he came in, all he could do was sit in that room and cry. He could not speak. I mean, it was so hard for me to sit with him because, we're so accustomed to the man being strong and, looking for him to spout off his issues and talk about stuff, but he just cried, and I really found it hard to not cry with him. He just was sobbing.
Yeah.
And so when he finally composed himself, I asked him, where were those tears coming from?
Yes.
And he began to talk about the fact that his wife didn't understand him, that he really loved her, but that she didn't have a concept about how he did love her, and the way he demonstrated that love was to provide, and he was trying to do that, and she had all these complaints, and he just felt like he was a total failure in this relationship.
I see
And
that
so
a lot,
later
too.
that day, I thought, and I know it was a God-inspired idea to do an interview with men to try to determine the things that make men cry.
Wow. So, and then from there, it inspired you to write a book and then a play.
Yes. So after interviewing 13 men, and I did in-depth interviews that were tape recorded, and I used that data to write the things that make men cry. Because one of the things that we do as women, sometimes we try to speak for men, and I didn't want to speak for them. I wanted to hear from them some of the things that bother them emotionally that they may not express in the same way women do, so they keep them inside. And so the book was written, and it was very successful. People were really blessed. I was able to share in many different venues the content of that book. And someone said to me, now, you need to write the play. And I laughed at them and said, yeah, right.
Yes.
Are you kidding me?
Yeah.
And they said, yeah, you really do need to write the stage play because we don't focus on men. And so when I thought about it, I thought about the place where men assemble, and that's a barbershop.
Right.
And so the set for the stage play is a barbershop, and the rest is history.
Yes, it is. It was actually wonderful.
Thank you.
Really wonderful. So, in your 13 men, as far as kind of a trial and listening to them, what did you kind of learn, some of the common denominators? I know you kind of spoke about it a little, but can you give us a couple of case studies of a couple of the people, or several? Because I'm sure there's a lot of men watching this show right now, and women, that are going to see themselves in some of these stories.
Well, because I'm an academic as well, I really approached it from a research perspective. So
Right.
I was able to gather the central themes. And one of the themes was men cry because they don't have dads in their lives. And I didn't realize how big that was because I had my father and my brothers had their dad, in their lives until he passed away, and they were fully grown.
Right. Right.
So I didn't have a concept of men not having
And then we're
fathers.
women. We're
right.
women. Yeah.
And we hear the need for men to be in the lives of their daughters and how important that is. But I didn't realize how significant it was for these men to not have dads in their lives, and even stepdads who were there. And what was interesting, some men were physically there, but they were not emotionally there.
Right.
And
right.
women protect men. When they go to work, the women would keep the children away from the men so that the man can, rest so he can go back to work.
Exactly. keep
and so
bringing
keep
in
the children
money.
away.
Yeah.
Don't bother your dad. And so they were missing that affection and love and support. They mainly would get discipline from their dads.
Okay.
And so either they weren't in the home or they were there in those ways. Another issue that I thought was really, really powerful was men missing their children. We hear women talk about the deadbeat dad or the dad who's not there in the lives of their children. And someone will make the assumption that men don't want to be there. And I do believe that we learned in this research that men do want to be there, but they don't have the capacity to do that bantering and that war that sometimes women so easily can engage in. So they would abandon the ship because they couldn't handle it. That's no excuse, because they needed to be in the lives of their children. But when you understand that, that helps you to think differently about men.
Yeah.
And so that was another issue, that they couldn't be in the lives of their children. To hear one man say, I can't be there to put the cover over my children at night, to read them a bedtime story because of divorce or separation. And then also for the men who have lost children through death, which is a very interesting dynamic, because sometimes men and women who are married divorce after the loss of a child.
Yeah, I've seen that
Because
too,
he
yeah.
grieves differently than she does. And so that's another dynamic. But something very relevant to today's society, men also cry because of social issues like racism and discrimination, trying to be a provider, trying to have a good job, to get equal pay,
Right.
and to be discriminated against over and over and over again, to have to see images like we saw over the weekend to remind us
most definitely.
of those things. So men are crying on the inside because sometimes they feel helpless and they can't fix problems, which men tend to be geared towards doing.
Yeah.
A real man fixes problems.
Yeah, and I can't say this is the cause, but what you're bringing up this point, we see so many men now with prostate issues.
Yes.
Besides being enlarged, I see a lot of prostate cancer. So, and it's all related to emotional links.
Yes.
All these cancers and things happening to our bodies. So
It's stress.
it is stress. So I usually tell everyone to make sure, if you're under a lot of stress, please, please, please check your hormones, or most important, check that cortisol level. And you actually can check it yourself. You can go to Life Extension website and order your own lab work. You don't need a doctor's prescription. Lifeextension.com. Order your lab work. They do a 24-hour urine test, 24-hour testing for the cortisol level, because it rises and falls through the day. If yours is staying high through the day, you're setting yourself up for heart disease, cancer, diabetes, a whole array of illnesses. So it's so important that you be more proactive. And if you know you're under stress, they always have a wonderful discount as well. Lifeextension.com.
Oh, that's excellent.
So please, you can order all your blood work. So sometimes you don't have to wait to get that next appointment if you're under an HMO to see where you are, or you want to see what's going on with your child, even your cancer markers. You can actually do these tests yourself. You don't want to treat yourself. You want to make sure that you're with a licensed practitioner to go through the rest. If you don't understand it, you can always give us a call or talk to your doctor once you get the results back. But you need to understand what is going on with your body, especially during stressful events. And right now, watching the news, if people talk about pH testing,
wow.
If I test you and test your saliva after you watch the news, your body is very acid. And if your body is acid, I don't care how much food you're eating, and drinking alkaline water, which there's a whole nother show on that, and drinking alkaline water, you are going to still be very acid. I advise everyone, check your pH while you're watching. So get the gist of what's going on, but don't stay glued in front of the TV watching the news. It's so toxic.
That's good advice.
It's very, very toxic. So, and then you walk away from that and you're angry. You're angry from what you have seen. And then you wonder, why am I depressed and angry? And you just sit there and watched all these things happen to men.
Right.
Especially a lot of our African-American men.
Absolutely.
So it's a lot happening right now, and there's a lot going on with hate. I mean, we have to find more love in our heart. And we're going to talk about that a little bit more. But let's go back to your book and the things. Let's go with another case study. I really like that one as well.
Yeah, another issue are the male-female relationships.
Oh, yeah, that's a big one.
Yeah, that's a huge one.
Yes.
Because men and women do not understand one another, and I do a lot of work with women, so I'm always trying to teach women to avoid expecting your man to respond to you or engage with you like your girlfriends.
Right.
They're just not going to do it. They want to fix the problem. And when they can't fix the problem, they feel like they are a failure. So when you bring something to them, we'll talk to our girlfriends, we'll tell them everything that happened at work or happened in our lives, and they sit there intently and they'll listen and they'll jump in and they'll come up with solutions and, respond. But a man, he's thinking about it. He is processing it. Now he's thinking, I got to fix that. And so he'll come up with a solution. And many times the woman doesn't really want you to solve it. She just wants you to listen.
Yeah.
And so because of that dynamic, we have a lot of misunderstandings in relationships. The difference between men and women, we'll talk about those issues or those misunderstandings. Men will not.
They just suppress it and
They
bury
suppress
it
it.
and bury
And
it
then the
push
next
it
thing
down.
they do is shut off and shut down. And then before long, they have dismissed you emotionally. And that's where you see other things happening, like self-medicating by going with someone else, having another partner, doing something else to, take care of that void.
Right.
But we don't understand it. So if men and women can understand each other better, I think that we'll have a, easier time in our relationships. But men cry inside because of those relationships. And women are very quick to say, he doesn't care. I used to be
I hear that
married,
a lot.
and and I'd be on one side and he on the other side, and I'm fuming. I'm saying he doesn't get it. He doesn't understand. He doesn't even care. Well, of course he did, but he just did not respond the way I would respond. And so we have to learn that there are those differences in men and women, and men have to begin to talk about their feelings.
They do.
Because they won't talk about their feelings.
And then the woman has to listen.
Yes.
Yeah, has to listen.
And not try to be the expert.
Most definitely.
Yes.
Most definitely. So, so what tools would you give a person, to kind of walk away with relationships and some advice so that they can start maybe from this moment on, even when their husband come home today or their significant other, they could have a better relationship?
I think women are very pivotal in relationships. I think men really look to us to help them in a way that's helpful. And a lot of times we try to help in the ways that we know how to help. So we end up parenting our men. And they don't need a mother at that point.
Right.
That's not what they need.
I see that.
Yeah, so
many
we can
times,
instruct
right.
and we can,
Pick up your clothes.
Yeah.
Do this.
Oh,
you
yeah.
can do this.
We become a parent, and they don't need a parent.
Mm-hmm.
And sometimes just asking a man, how was your day?
Mm-hmm.
I know it's hard because it says to the man, I appreciate you for going out to work or going out to hustle, doing whatever it is you're doing.
Right.
But I appreciate that. So how was your day?
Mm-hmm.
And then simultaneously, men need to also understand these things about women too.
Exactly.
And sometimes, because women are more verbal, when he's asking that question, he really is not interested in hearing all of those little finite details that we can do, because we use a whole lot of words and we can talk way too much. And so he may not want all of it, but he needs to learn how to let her know he cares about her in that way, because that's very important.
Yeah.
When a man shuts down for a woman, that's worse than anything else. Because she feels that separation, and that's very difficult. And so it's important for men and women to begin to try to understand each other. Be okay to seek counseling.
Yes.
Don't wait until the relationship is, on its deathbed.
Yes.
Yes. Because then it's hard to resuscitate it.
Mm-hmm.
But if you know that there are some issues in your marriage and there are some growth areas that need to happen, seek the help of a trained mental health professional, because
Right.
they can help you to sort things out and to process and to put things in different perspectives.
You really have to meditate for that meditate and pray over that right person you're going to.
Yes, you do.
Because not everybody work like you do.
Yes.
And some people can sometimes be damaging.
Absolutely. And that's why you get to interview a therapist. I tell everyone, Do
Good.
not
Good
just
advice.
believe that you have to settle on the person you go see,
Mm-hmm.
even if it's a part of your insurance panel.
Mm-hmm.
You can say, I want to meet you, consult with you, and then you
Very
can
good.
have
Very
a
good.
sense
Mm-hmm.
about how this person operates.
Mm-hmm.
Do they understand my cultural world? Are they saying things that resonate with me so
Yes.
that I'm not thinking that they have to tell me I'm right, but
Yes.
at least I know they get it?
Right.
I
Right.
need to feel that when I meet with someone. And if they aren't doing that, then I can go to the next person.
Mm-hmm.
So knowing that you have those rights is very, very important.
What percentage do you see now? What stay-home dads who are taking care? Because there's a lot of single fathers who are doing a great job. So what do you see with the stay-home dads? Where the woman now goes to the wife or whatever goes to work.
Well,
Do you see a
because I'm
lot?
in a different setting now, when I had my private practice, most of my couples worked, both parties worked.
Okay.
And now in the clinics, it's interesting because I do work with low income families. And so some men are at home because they don't have jobs
Mm-hmm.
or they are on disability. And so women will do little odd things to try to, make ends meet to help. But they're home for those reasons. And there's a lot of frustration
Mm-hmm.
because real men really want to provide,
Yeah, they do.
and I
Mm-hmm.
think that we have downplayed that when a man is not working. We just think he's just happy not working. But real men do want to provide, want to participate in helping to take care of things in the household.
Mm-hmm.
And so it can be very, very difficult. But I always say this, if you are working as a female and you have a substantial job and the male has the job of staying at home, to me it's the same as a woman staying home. If he's caring for the children, making sure everything is taken care of, and that's the role because he's ill or because he can't find work or because the couple has made that decision,
Mm-hmm.
there is nothing wrong with that.
Now, in your line of work, what do you think men need to do to stay healthy?
Number one, they need to have a healthy mind. They need to
Exactly.
deal with that stuff, the things
Mm-hmm.
in their mind.
Mm-hmm.
Some of the things of the past have really paralyzed men, and they haven't had a vehicle to talk about those things. They have kept them inside. The way a man treats a woman is sometimes very reflective of how he experienced his own mother and father. And so men sometimes have to be retrained,
Right. Right.
and nurtured, and it takes time to do that. And women often say, I'm tired of trying to teach him how to love me.
Mm-hmm.
Well, he doesn't have a model. He didn't have a model for that. And so through kindness, you can teach him. But you too have to be willing and able to love as well.
Right.
Because women have the same experiences.
Exactly.
If a woman has been through trauma, if she has experienced a marriage that was violent, or she's had relationships that are violent, or she's had infidelity in her life, she brings all that
Baggage with her.
into that relationship.
Exactly.
So no matter what that poor guy does, he will never be okay.
It's too bad we don't have an organization, and maybe they do by now, I don't know, that you can do not so much a premarital counseling, but maybe know more about that person and background instead of getting so much into the physical
Yeah.
when we meet people, and maybe find out what relationship that you have with your mother, with your father, with your siblings, and where you stand about things. I think people don't ask enough questions.
Oh,
In
you're talking
relationship.
about my new book and play.
Okay.
Yes, I have a new book and a new play called Don't Date, Investigate.
Oh, I love that. I
And
love
the
that.
essence of this is not what you think, because a lot of times people think, well, you're talking about investigating the other person, which you do need to do that. But if you don't investigate yourself
Yourself. Mhm.
to know who you are, to know whose you are, what you're supposed to be doing, your gifts, your talents, skills, and
Exactly.
abilities,
Mhm.
your strengths and your areas of growth. If you don't know all of that and you're working on those areas of growth, then you're not in the right position to even go into a relationship, because you're going to get with somebody based on the limited information you know about yourself. And then when you learn about who you are throughout your life And then you look at that person, you say, oh my gosh, what did I do?
Yeah.
Because if I knew then what I know now, I never would have been with them.
Exactly. You know, it's really odd because I have a book also entitled Written Before I Was Born. And one of the chapters I talk about through the eyes of a child. Because through the eyes of a child, what I saw, which was real, and it's no love. I didn't see the passion. I didn't see the love. I don't ever remember my mother hugging or kissing her husband, which was my stepfather. So it was no passion. So later it was just like things are okay. I can live without it. I can live with it. It's okay. And then I've been through a marriage, and which I kind of married somebody like my father who was not affectionate. So, I, you know, you learn as you go through this. This is why we're having this show today. So hopefully other people can not go through what we've gone through in our lives and kind of grow, you know, more positive in a more healthy relationship, which I think is so important. But a lot of things as we view it as a child, that's why I've done the book that I've done. That covers a lot of it too.
Yes.
Yeah. And the trauma as a child. So a lot of people who have listened to it have said, my goodness, too much trauma for one child, too much pain for one child is one of the chapters. So the thing is to know what you've gone through and to know who you are, and what you have to know that, and be authentic.
Right.
In a relationship.
Right.
You have to be authentic. Tell a person what you like, what you don't like. You know, if they don't like it, that's just not the one for you.
Right. But if you don't do the work to heal
yourself,
you know, if you don't get the healing in, then you're operating out of your brokenness. And so that person can very easily become your everything, which is dangerous for anybody to have that role besides God. Because that person is going to let you down because they're human, as you are going to let them down.
And I see that. I have a couple of dear friends right now, and they're just like, oh no, he's everything. And I'm like, I pray it stay that way for you, but you know, what are you bringing also to the table?
Right.
And what's happening? And you haven't fixed some things with yourself, but these are people who know everything. You can't tell them anything. So I don't do that with friends. You know, I just don't do that.
Or you just send them to therapy.
Yes.
Let them pay for it. They listen a whole lot better when they have to pay.
I think so. Especially if we're just too close. But I see that a lot. So, and I've seen men do that to women. I've been engaged many times. And that's why I couldn't go through with it, because they kept telling me, you're exactly what I'm looking for and this and that. I'm like, well, this is not really what I'm looking for, but I was what they wanted, because I'm a very nurturing and caring and giving person. But it has to be something that is for both parties.
Well, you have to love yourself enough.
And then I do.
Yeah.
Took me a long time to get there.
Yeah.
And I put that in my book as well, because I stayed in the marriage for as long as I did, because I did not love myself. I had skin issues from a condition, and I didn't love myself or accept myself, because I had all these not lesions, but scars on my body. And because he did, now they're so faded away that people say, I really don't even see them. You know, and it's like, so I had the internal scars more than the external. So I couldn't deal with that. So I stayed. So finally, when you get to a point to say, you know what, I love myself enough that I can now walk away from this, because it was very toxic. You can walk away.
Right.
And stay friends with the person. So
you can also recognize when you care about yourself, you can recognize early on things in people that will either be appropriate for you, pleasurable for you, or something that can wreak havoc in your life. And when you feel good about yourself and you're healthy, you're okay to say, you know, it was really nice, but I gotta go.
And that's exactly what I have done.
Yes.
And still everybody's at peace, and even some ex-fiancés, we're all still at peace. And it's just wonderful.
Yes.
You know, very good friends. No friends with benefits, but just friends.
That's right.
Yeah. Just good friends. So, you know, what are some key things that you would say with women to do to keep the relationship, keep the fire in the relationship?
Well, it's so interesting when you ask that question, because I chuckle when we say that, because it's almost like the woman is responsible for doing something to light up the relationship.
I
But
know.
no, but you're right. If she keeps the light on within herself,
Yes.
it's nothing that she can do besides be her authentic self. She can
Authentic self.
exercise kindness and understanding.
Mm-hmm.
Men are not as complicated as we make them. They're really pretty simple, and this is not a negative thing.
Yes.
I go to the mall and I see men sitting, waiting on their wives or significant others, while she's shopping and running all over the store, and he's just sitting there. He's simple, and she's happy because he's there, but he's simple. And so if we just learn to not overly complicate it because of our issues. So number one, we have to be healthy. You will never be in a good relationship with another human being without being healthy. Because if you're not healthy, you're more paranoid. You always think somebody's out to get you. You're always insecure. You're feeling like you can't trust this person. And I say this, maybe I can't trust you, but I trust the God in you. So be careful about who you get with, because if the person has the capacity to love God, then they're going to do pretty good with you. So they may not be trustworthy, like I may not be trustworthy, but the God in me kind of keeps me held to a certain standard.
Exactly.
So we've got to be healthy and take care of ourselves mentally, physically, and spiritually.
Yes.
You are not going to be doing well in a relationship if your health is poor as well.
Exactly.
When you're sick, you can't do the things that are expected of you as a spouse.
And what happens when, I had this really wonderful patient years and years ago, and I tell people, if you didn't have it in the beginning of that marriage, and if something happened and someone become ill, it's not going to be there.
Right.
If you marry for the wrong reason. This case was the most lovingest case I've ever seen, and I've said it on the show before, only because it was so powerful. This couple had been married for, I think about 6 years, got married in their early 20s, had 4 children, different nationality backgrounds. Because she was from a different nationality, her family did not want her to marry this man at all. And they were at a family picnic, and she sustained a gunshot wound to the back of the neck. Well, when this happened, she became paralyzed from the waist down. And this man was a truck driver. They had a beautiful home, and I saw pictures of that later. So by the time I met them, they were in a small house, comfortable. He said, I am not going to put my wife in a home. So he hired people to be there. This lady had been in a bedridden when I met her for at least several years before I had came. She didn't have one bed sore, not one decubitus, nothing. And she would sit there with a trach and smile. She was just so full of joy and so full of love, because they had that prior to the accident. He would come home from work, and I would say, Mr. So-and-so, you probably should stretch out, and go to bed, because she's in a hospital bed in the living room. He said, as long as I can feel her hand and feel her presence and see her warm smile, that's all I need. I love her so much.
Wow.
And they were together for a long time. And this lady would blush and smile, just like they had just met each other.
Wow.
So you had love between you, accept each other, before all this happened. And you have to have that.
Right.
And her family told him, we would not be angry with you if you would put her in a home. So he sold his house to buy a generator at home. So this was during the time that people were going to drive-in theaters. He would take that generator and her in a bed in a wheelchair to watch movies. He took the generator to go camping, so she could enjoy life. Now, how many people would do that? How many? You have to have that love prior to, going any further in relationship.
Absolutely.
I feel you have to have that.
Yeah. And the agape love.
Yes.
That
Yes.
love that is unconditional.
Yes.
Because we tend to not have that. I hear people talking about getting married, and it's so amazing. I do premarital counseling, but only if they don't have a date yet.
Okay.
Because if they have a date, they're going to get married even when you see that this is a disaster in the making. And so
I know some people have done that, yes.
Yeah, whatever you tell them, they're not going to hear it because the dress has been bought, we have the date, and we spent the money. But I hear people talk about as one of their options, if this doesn't work out, we don't have to stay together. So people go into marriage now knowing that there are clauses and there are ways for them to end their relationship if they don't work out.
Exactly.
So they don't go in with the kind of love, in which I want to debunk a myth. Love does not always happen instantaneously.
Exactly.
It can develop and nurture over time, but you have to really like the person.
Yes.
You have to like the person. The love will come.
And the respect.
That's why I love friendship first. If you can really be a good friend with a person, there's a potential for you to have a long-lasting love because you already dig them. You already like them.
Yes.
And so it just makes it easier.
Yeah.
And sometimes on the flip side of that, sometimes the love can complicate it when you should have just stayed friends.
Yes.
But we have to have the capacity to be comfortable giving and receiving love.
Yes.
And if we aren't, we are ready to bail as soon as it gets hard.
And then be honest with yourself. And that's what I
Yes.
had to do. And I noticed a lot of other people to be honest with yourself. Does this person really love you and have already said these words and have proposed, and you really don't feel that? Just don't do it just because of him. You got to do this because you feel the same way. It's not just a one-sided type of relationship. It has to be both parties. So, you've hit on some really great things. I can't wait to see the next play. But let's go back to the play, too, the things that make men cry. We hit on some, and I know you have some other little, not so much little, but other stories.
Well, why don't I talk about some of the stories in the play? Because we pick up on the issue of the father and son dynamic.
Right.
That's the central theme. But also, I pick up on the men who are part of our LGBTQ community who, as young men, come out to their parents and, say, this is who I am. And one of the things that can happen with that is that person can be ostracized, abandoned, beaten up, criticized, and just actually, told, I am no longer your parent if you make that choice.
That happened with, I know you're talking about the book, with a couple of my patients, their daughter, and she said, I don't want anything to do with her. I said, your daughter's reaching out to you. I have several patients like this, and I said, you need to not turn your back because of their lifestyle. You love them. It's only one person that carries, we all know what, God says, the Bible says, but it's only one person they got to stand before themselves. You need to just love them.
Well, the issue is we have a high suicide rate of young people who come out and they cannot be who they are with their parents because they will be rejected. And once they are rejected, then they are very, very sad and depressed.
Yeah.
And depression is a huge factor for men. We don't hear about it as much because they don't express it and present it the way women do. So for men can become more angry, more aggressive when they're dealing with depression. And so we've got to start understanding
That's pretty
some of
powerful
those
to say.
things.
I don't mean to cut you off, but I really want you to put more emphasis on that because I see a lot of that, the angry and depressed. So really kind of hit that again with depression.
Yeah, because, the presentation of depression, the symptomatology is sometimes very different for men and women.
Right.
Women may cry. They may withdraw themselves, isolate. They may eat more than they normally eat or eat less. They may sleep more, sleep less. But what we tend to see in men, in addition to some of those symptoms, we can see the anger. And because it's so poorly understood, even when there's a domestic violence situation, we send men to anger management, and we think that that will correct the problem.
Right.
When there are some things they need to work through, they really need to be assessed for depression. Because if they are, it is treatable.
Yes.
And we know that they can get some help. But because they don't do that, they send them to anger management only as a strategy. Sometimes they end up going right back to that cycle of violence because they have not dealt with the real issue.
Right.
So back to the story of the LGBTQ community, where there's a gay young man, he is very ill because of his broken heart.
Right.
There's a line in the
Right.
play that says, "I did not get AIDS because I'm gay. I contracted AIDS because of a broken heart." That broken heart sent him out into the street.
Yes.
And so for survival's sake, he did things he would not have done had he had been in a loving environment where his parents may have said, we really are not happy with your choice. This is not our choice for you, but we love you.
Exactly.
And we're going to continue to show support for you.
Yes.
And that could have changed everything in his life.
Yes.
So we have to do a much better job, especially people of faith. We act like we are in a vacuum somewhere.
Oh, I know.
In every church, there are people in the LGBTQ community. And so we have to exercise what you talked about earlier, the concept of love. Because if we love people, then we'll be able to help them in whatever way they need to be helped, to feel loved, accepted, and that will help their mental health.
Exactly.
But if we abandon them and ostracize them and say negative things about them, then we create more poor health for them.
Yes.
Because now mentally they're not going to do well.
Now, I want to get into another topic, only for a brief moment. Is it okay?
Sure.
Since we have a male as the president, and you're into, it's a clinical psychologist.
Oh boy.
Not asking you to diagnose anything on this man, but we all see it. We all see it. So, but what's happening right now in the other states and the racism and different things, how is this really, do you see as a practitioner, how is this affecting the men? Because all you see right now is the men, with all this racism and hate. And I mean, it's just really, really, it's so sad.
Well, there are two things that I have thought about what we're seeing right now. And first, to go to President Trump. One of the things that is very interesting is because I come from a psychological perspective.
Yes.
And I just believe that the things that happen early in our lives can shape us into being who we are. And, and what President Obama said was very accurate, that, hatred and racism, these are learned.
Yes, they are.
Attitudes, beliefs, and behaviors. And so he learned how to be the way he is. I'm not at all surprised by what we're seeing. He has demonstrated that. That's why, as I watch this, I say, come on, folks. This is who was running for office. This is who was in the reality show.
Yeah.
This is the same person. So these are character flaws that he has. And I don't want to go into diagnosing him. I could, but I don't want to do that.
I know.
So I do believe that these are things that happen as a result of his environment. And he is manifesting that in his behavior. Now, the impact of that, however, has given rise to an undercurrent that has been going on for many years, but more vocally and more of a rumbling since President Obama came into office as the first African American president. These groups were not happy with that choice. So there was the rumbling. And so when President Trump comes along, he gives the opportunity for people to come out of the shadows. They've been in the shadows, but now he has provided the right environment for them to come in to the open. And so what it has done to those men, which I believe that sometimes people get caught up in that, who may not have that total ideology, but go along with the group, don't have the courage
Right.
and the wherewithal to say, this is not me. It's like the person that can sit and laugh at the racist joke or talk about somebody who's disabled, and we kind of laugh at it. We don't have the courage to say, you know what, that's really not funny,
Right.
and I don't think that's
Exactly.
appropriate.
Exactly.
But we all can be guilty of that. But when it comes to having torches and making the chanting statements that were made, that's much more intentional. That's down
Yes.
deep in your heart
It is.
to do that. So what has happened, Trump has impacted those folks who are part of those hate groups. But it has also impacted us, and especially our men, who now have another thing to worry about in
Exactly.
terms of providing safety for their families. This goes way beyond, this. As I watched this, I immediately thought about my son going back and forth through the freeways and back to work and where he goes. I thought about the fact that we don't know who will drive up beside him or who will be behind him.
Exactly.
That is representative of these people.
Exactly.
So what it has done is re-traumatized us. And I would love to talk to older people who were around when the KKK wore hoods. So it would be interesting to find out what they really think about what's going on now, because I can only imagine it is even more vivid for them because they lived it.
Yeah.
For our kids, we've shielded them. We haven't wanted to talk about history. We have not wanted them to understand the struggle that
Exactly.
we've gone through. We wanted
Exactly.
things better for them. So they really are seeing this perhaps for the first time.
Oh,
You
they
know,
are.
this is
My
a new
grandchildren-
experience.
My grandchildren are definitely seeing it for the first
Yes,
time.
but
yeah.
it's going to make us even more paranoid. I will tell you, even driving here, I've started looking even more carefully as I'm driving. And we have two kinds of paranoia. One is healthy cultural paranoia, where it is what you should be doing to be paranoid. If you go in certain areas, if you go into particular neighborhoods, if you go in certain stores, those places are notorious for racial profiling or for doing those things. So we develop healthy cultural paranoia. We're going to try to stay away from those places. We're going to go around out of the way to get there. But unfortunately, we may have more of the unhealthy paranoia because we don't know who's who.
Right.
So now I'm more anxious about my surroundings altogether. And that is not good for our health.
No, it isn't.
And so that's what I think the impact is on African American men who now have to keep in mind that now they've come out and now they're saying they're coming to other places. So now I've got to be hyper vigilant because my job is to protect me and mine.
Yes, exactly. We're about ready to wrap up the show. And so I want to, if you can, in 30 seconds or less, to take a look at our audience and what departing words would you want them to have as you.
Well, I just want to
End the
say
show.
to every man, especially every African American man, you are important to us, to your families, to your women in your lives, to your children, to the community. We need you. So it's very important for you to be healthy. And for the women, we are going to have to do better ourselves, to be greater supporters, to try to be understanding of the men's struggle, and then to make sure we love ourselves enough to not get into toxic relationships where we're constantly trying to fix the man in our lives to be the man we want him to be.
Exactly. I want to thank you so much. And for those of you who don't know, our phone number where I can be reached is 310-419-4300. We do some special things there too with emotions, and because I deal with that as well. So give us a call if you have any questions or concerns, 310-419-4300. And again, Dr. Morrow, I want to thank you for being here.
Thank you so much
Thank
for
you
having
so
me.
much.
I appreciate it.
Thank you. This has been wonderful. The time went by so fast.
Yes.
And as I always end my show, repeat after me, because I am truly blessed and I am so grateful. Yes. But repeat after me. I am so grateful
that
I am a magnet for miracles. Everyone, please take the time. It doesn't cost you any money to give someone a smile and give someone a hug or a compliment. God bless you. Have a wonderful week.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.